How to get rid of chest congestion. Chest congestion, and the coughing that typically goes with it, can make a person feel quite miserable. It can also interfere with many aspects of one's life, from attending work or school to trying to sleep at night. Know when to see a physician and learn some of the best ways to relieve chest congestion, such as making changes to your environment, eating and drinking the right things, trying home remedies, and taking medications. Method 1. Knowing when to see a doctor. 1. Understand chest congestion first. Chest congestion is the result of excess mucus and other fluids in your lungs. It is generally caused by the common cold, which is a viral infection in your respiratory tract, complications of the common cold like viral acute bronchitis, bacterial bronchitis, and bacterial or viral sinusitis, chronic bronchitis, which is typically the result of smoking, nasal polyps, which are non-cancerous growths in your nasal passage, allergies, hay fever, environmental irritants, or the flu. Often nasal congestion leads to chest congestion. 2. Wait it out 1 week in general. If your congestion is caused by the common cold, it will usually clear up on its own in about 1 week without the use of prescription medicine. Most are viral infections, which can't be treated with antibiotics. If it doesn't improve after a week, you should make an appointment to see your physician. Viral infections can become bacterial and generally require treatment with an antibiotic. It's very important to also consult with a physician after a week if you have asthma or a weakened immune system. 3. See a doctor before a week in some cases. Set up an appointment if your congestion is accompanied by wheezing, or if you have a high fever lasting more than 3 days, experience bloody discharge from your nose or from your mouth when coughing, or have green nasal discharge with pain and a fever. While some of these could be the result of a bacterial infection, they could also be indicators of something more serious. 4. Go in for a cough lasting more than 4 weeks. Coughing is common with chest congestion, and you don't want to suppress a wet or productive cough that produces phlegm or mucus unless it's severely impairing your breathing or sleep. Productive coughs helps clear your lungs and lower respiratory tract. Avoid cough suppressants unless your cough is extreme and preventing you from sleeping or breathing. If you're still coughing after 4 weeks, however, schedule an appointment to determine and treat the underlying cause. Method 2. Changing your environment. 1. Use a humidifier at night. Warm, moist air not only helps to relieve coughs but also to loosen mucus in your lungs. This makes getting rid of the mucus through coughing, the use of certain medications and other methods more productive. Humidifiers work well because they add this needed water vapor to the air. They're also helpful for those suffering from allergies to mold, mildew, or dust mites. The ideal level of humidity in a house is between 35–40%. To see if your home is at that level, buy a humidity gauge from a hardware store or pharmacy. Make sure you regularly clean the humidifier. They can fast become havens for mold, fungus, and bacteria. Those with asthma should consult with a doctor before using a humidifier. 2. Steam out the congestion. Another option is to use steam to help break up mucus in the chest. You can do this by taking a hot, steamy bath with the bathroom doors closed and the vent turned off. You can also sit on a chair or on the toilet to breathe in the steam. Finally, you can boil a pot of water or run hot water in your sink before carefully leaning over the steam and inhaling it. Draping a towel over your head helps with this technique. With all methods, breathe in the steam slowly for about 5 minutes and then try coughing or blowing your nose to purge the mucus. Amplify the effects of steaming by adding eucalyptus oil to your boiling water or sink of hot water. Eucalyptus is a natural decongestant. 3. Remove irritants from the air. Scented products and bathroom sprays can create sinus irritation, which can then lead to chest congestion. Paint and household cleaners can also create problems for many people. Either don't use these products or avoid overuse to reduce this irritation. Smoke is another powerful irritant that causes congestion for both the smoker and those around him or her. The best solution is to stop smoking or to smoke outside. If you need to use paint or another potent substance, wear a face mask and open your windows to let the fumes escape. If allergies are causing your chest congestion, try to rid your home of those allergens that affect you. 4. Reduce your exposure to other allergens. Try using a mattress cover if you're allergic to dust mites, and keep pets off your bed if you're allergic to pet dander. If pollen is a problem for you, keep your home and car windows shut and use an air conditioner to filter the air. You might also use a HEPA, high-efficiency particulate air, filter. Method 3: Eating and drinking the right things. 1. Stay hydrated. Drink more water and other fluids than you normally would. This will help thin mucus and break it up, making coughs more productive. Try to drink a tall glass of water or another fluid every 2 hours. Avoid caffeinated beverages and alcohol, however, because they are diuretics and can cause you to lose more fluids than you consume. You can also increase your fluid intake with broths, soups, and teas. In fact, hot liquids help dissolve the mucus. You can also put a hot water pack over your chest to help loosen mucus. 2. Eat chicken noodle soup. Chicken noodle soup helps reduce lung inflammation. It also increases your body's ability to move mucus through your body and get rid of it. Additionally, chicken noodle soup helps kill viral cells and can prevent the growth of new ones. Scientists aren't certain why chicken noodle soup does these things. They think that the heat, salt, combination of ingredients found in most chicken soups, and the hydration it provides are the likely reasons. 3. Drink certain teas. Studies have shown that both honey and lemon decrease the growth of microbes that cause infections. Honey in particular inhibits viruses and has been found to be an effective cough suppressant. Try mixing a teaspoon of both lemon juice and honey to hot water. Green tea appears to be effective in helping treat respiratory infections that are the prime culprit in chest congestion. It also has been shown to inhibit viral activity. While not scientifically proven yet, many find relief from adding thyme, marshmallow, licorice, ginger, cinnamon and clove to hot water to help loosen mucus. To make a thyme tea, add 2 tablespoons of fresh thyme or 1 tablespoon of dried thyme to a cup of hot water, let it steep and then drain the thyme. For a marshmallow tea, steep 2 teaspoons of the dried herb in 1 cup of hot water. Brew a licorice tea by adding 45 drops of licorice tincture to a cup of hot water. For a spicy tea, add a half teaspoon powdered ginger, a pinch of clove and a pinch of cinnamon powder to a cup of hot water. 4. Consider avoiding dairy. Because chest congestion is so often caused by allergies and other nasal congestion issues, consider cutting out or limiting dairy in your diet, particularly if you're allergic or sensitive to it. While the research is mixed on whether the casein in dairy products promotes mucus, it should be noted that casein is used to create adhesives, and some people think it makes mucus thicker. Method 4: Using home remedies. 1. Try a new way of coughing. If you're coughing a lot but not getting relief, try this to help loosen mucus. When you feel a coughing fit coming on, make a series of small and gentle coughs. Finish with a deep cough. The smaller coughs can help move the mucus, while the last cough can help get rid of it. 2. Take the right supplements. If you choose to take a supplement, the National Institute of Health has found the following to be possibly effective in either reducing the symptoms of a cold, including congestion, or in helping prevent illness in the first place: vitamin C, vitamin D, ginseng, echinacea and zinc. The following have not been designated as possibly effective: olive leaf extract, garlic, elderberry, whey protein, probiotics, golden seal root, or airborne. This isn't to say they aren't effective, but the research is not as supportive as for those listed first. Be careful when taking supplements. Taking too much can be life-threatening. They can also be harmful to children, pregnant or nursing mothers, and other populations. Talk with your doctor before taking them and read the safety information thoroughly first. 3. Relieve nasal congestion. Often half the battle with getting rid of chest congestion is clearing your nasal passages. 2. Post-nasal drip seeps down your throat and into your lungs. This often creates or makes chest congestion worse. Here are some home remedies for relieving nasal congestion. Sleep with your head raised. Put 1-2 extra pillows under your head so that it's raised 6-8 inch if you find yourself coughing a lot at night. Irrigate your nasal passages with a neti pot or other saline nasal irrigation system. Make sure you sterilize the water as instructed. Deaths have resulted from using straight tap water. Yoga poses, such as the reclining bound angle, cobra and bow, may be helpful in opening up nasal passages. Don't overdo it while sick, however, because too much exercise isn't conducive to getting better more quickly. Instead, do them in mini sequences. Method 5: Taking medications. 1. Use an expectorant. There are two types of cough medicines: expectorants and decongestants. Decongestants are used to temporarily dry nasal passages. An expectorant thins out and loosens mucus in your chest, thus helping to induce a productive cough. Look for one with guaifenesin. The FDA advises against giving cough or cold medicine to children under 4 unless directed by a doctor. Additionally, pregnant and nursing mothers, and those over 60 or who have chronic respiratory problems, asthma, heart disease, high blood pressure or an enlarged prostate should take cough medicines with care. Serious side effects can occur. 2. Try an antihistamine for allergies. Consider using an antihistamine if your chest congestion is allergy-related. They help to temporarily dry up nasal passages. There are 2 generations of antihistamines. The older ones, such as chlorpheniramine and diphenhydramine, Benadryl, typically make people sleepy. They can also create concentration problems. Second-generation antihistamines, such as cetirizine and loratadine, have fewer side effects. They can still make you drowsy, though. Drink extra fluids while taking an antihistamine due to their drying nature. 3. Use a chest rub. Chest rubs like Vicks VapoRub can help loosen mucus and reduce coughing. Buy one containing camphor or menthol and apply it to your neck and throat. Never take them internally. Homeopathic chest rubs containing eucalyptus and myrrh can also be helpful. You can also make your own by mixing 1 part mustard powder and 2 parts all-purpose flour with just enough water to create a paste. Spread the paste on a dish towel, fold it and place it on your chest. You can substitute an egg white for the water. Either way, never apply the paste directly to your skin as this can cause serious skin irritations. 4. Suck on cough drops or lozenges. Look for one with menthol, which will help numb the back of your throat and decrease your cough reflex. Remember, however, that you don't want to suppress a productive cough unless it's seriously impairing your breathing or sleep. You can also try sucking on horehound candy if you have a productive cough. Horehound acts as a natural expectorant. Try slippery elm lozenges for a dry cough. It will coat your throat and reduce coughing. Give cold EEZE a try. The active ingredient in the lozenges and sprays is zincum gluconium. Clinical studies have shown that cold EEZE can reduce the length and even the frequency of the common cold. 5. Take a cough syrup. There is a variety on the market, and you should select one based upon the type of cough you have. You can also make your own. For productive coughs, use herbs that act as natural expectorants, such as horehound, thyme, mullein, fennel, and ginger. Simply slice 3 lemons and place them in a pan with honey and one of these herbs. Simmer it until the syrup thickens, strain it and let it cool. You can make another easy expectorant cough syrup by covering a thinly sliced onion with honey, letting it stand for 10-12 hours, and then straining the concoction. Take 1 tablespoon several times per day. 6. Relieve nasal congestion. Decongestants containing dextromethorphan or pseudoephedrine, saline nasal sprays, and nasal steroids help to temporarily treat nasal congestion. Antibiotics can be used, but only if a viral infection becomes bacterial. Don't use decongestant nasal sprays for more than 3-4 days because they can lead to rebound congestion. Tips: wash your hands and use a hand sanitizer frequently to decrease your chances of getting a viral infection. Getting a yearly flu vaccine can help protect you from getting the flu. Also consider getting a vaccination for pneumonia. If cold air makes you cough more, try wearing a face mask when outside during the winter.